So if you're dealing with neck pain, you've probably seen just how confusing the world of injections can be. But here's the thing, not all of these treatments are the same, not even close. And the difference? Well, it's absolutely critical. So we're going to give you a really clear map to help you navigate all your options and find the safest, most effective treatment for you. You know, it's easy to think a neck injection is a neck injection, right? The doctor finds the sore spot, puts the needle in, and that's the end of it. It seems straightforward, but I'm telling you, that assumption could not be more wrong. And we're not just talking about whether the injection works or not. The difference between these techniques is all about your safety. Understanding this is, without a doubt, the most important thing you can do before you let anyone near your neck with a needle. So, to cut through all that noise and confusion, we're going to break it all down into a super simple framework. We're calling it the 5-level system of expertise. Think of this as your personal guide to figuring out what a doctor can do and, more importantly, what they can't do safely. The easiest way to picture this is like a ladder. We start down at the bottom, at level 1, with what are called blind injections. Then we climb all the way up to level 5, which is for super specialized work in the delicate upper neck. And as you'll see, there's a little plus sign there for a reason. It's a critical distinction. But the main idea is simple. Every step you take up this ladder means more skill, better tech, and way more safety. All right, let's start at the very beginning, right at the bottom of that ladder with the most basic, and I mean basic, techniques. So a level 1 injection is, well, it's exactly what it sounds like. It's blind. The doctor literally just uses their hands to feel for the bones in your neck and then guides the needle based on touch and feel alone. There's zero imaging, no camera, nothing to see where that needle is actually going. Now, you have to remember, this technique was developed a long, long time ago, before we had all this amazing, inexpensive technology to guide us. So, to put it bluntly, doing this today in 2025, it just makes very, very little sense. And here's why it makes no sense. The risks are just terrifyingly high. If that needle is just a little bit off to the side, it can hit a major artery to the brain and cause a stroke. If it goes just a little too deep, it can enter the space around your spinal cord and cause permanent injury. The stakes are unbelievably high with this approach. And that brings us to the first massive leap in safety, just moving from level 1 to level 2. The only real difference is that a level 2 provider uses ultrasound. And that one simple addition, well, it's a total game changer. It dramatically reduces the risk, because for the very first time, the doctor can actually see where the tip of that needle is in real time. But, and this is a really important but, there's a pretty big limitation here. A level 2 provider is still kind of working on the surface. Yeah, they can use ultrasound to safely inject things like muscles, tendons, and ligaments, but they are just not equipped to treat the deeper sources of pain, like the tiny joints in your spine or the nerves themselves. It's much, much safer, for sure, but the scope of what they can treat is still pretty limited. So, if you need to treat those deeper structures, we've got to climb a little higher up the ladder. And that brings us to levels 3 and 4, which introduce some much more advanced imaging. And the key piece of technology here is something called fluoroscopy. Honestly, the best way to think about it is like a live, moving X-ray. It lets the doctor see your bones and the needle at the exact same time, which allows for just incredible pinpoint accuracy. And it's that technology that allows for the next big jump in scale. A level 3 provider uses that moving X-ray to guide a needle right inside a specific facet joint. You know, those little stabilizing joints between your vertebrae? This is a super common source of chronic neck pain, and it's something a level 2 provider just can't get to. So you can think of it like this. A level 3 provider is really focused on those joints, but a level 4 provider, they take it to a whole new level. They've got all the skills of level 3, but then they add advanced ultrasound training on top of it, which lets them treat really complex nerve problems too. So for example, a level 4 provider can do a pretty amazing procedure called nerve hydrodissection. This is where they use fluid to very carefully free up a nerve that's gotten trapped or stuck in scar tissue. A great example is the greater occipital nerve, which is a huge cause of headaches for a lot of people. This is a really sophisticated skill you just aren't going to find at those lower levels. And that brings us to the very, very top of the ladder, the expert tier. This is where the procedures get the most complex, and where the need for true, deep expertise is just absolutely non-negotiable. So what makes someone a level 5 provider? It's their ability to do injections in the upper cervical spine. That's the area right from the base of your skull down to the second bone in your neck. Make no mistake, this is the most delicate,
highest risk real estate in the entire spine.
But right here, we have to stop and ask a really, really important question. Just because a doctor can do these procedures, does that automatically make them an expert? Is just having some experience the same thing as having true expertise? Well, check this out. The source material points out that a pretty typical level 5 provider might only do these really complex upper neck injections maybe 6 to 12 times in an entire year. So yeah, they know how to do it, but it's not something they're doing day in and day out. And that lack of routine, high-volume practice, it can have absolutely devastating consequences. There's this incredibly sobering story about a patient who went to a level 5 provider for a tough upper neck injection. And because it was a challenging case, and the doctor just didn't have that deep everyday expertise, the procedure went horribly wrong. The needle actually ended up in the patient's brainstem, causing a permanent, life-altering injury. And that right there is the critical difference. For these most complex procedures, you don't just need a level 5 provider. You need a level 5 plus. This isn't just someone who has some experience. This is a true, high-volume expert who does these specific injections all the time and knows exactly how to handle it when things don't go according to plan. Okay, so after hearing all of this, the biggest question is, how can you actually use this information to protect yourself and make sure you're getting the best possible care? This chart pretty much sums it all up for you. Level 1, blind and high risk. Forget about it. Level 2 adds ultrasound for safety, but it's limited to the soft tissues. Level 3 uses that moving X-ray, fluoroscopy, to get into the joints. Level 4 adds the skill to treat nerves. And finally, Level 5 Plus brings that deep, high-volume expertise you need for the most delicate area of all, the upper neck. So the next time you're talking with a doctor about a neck injection, you are now totally empowered. You can skip all the general questions and ask one simple, direct, and incredibly powerful question. Based on the tools you use and the parts of the neck you treat, what level are you? Believe me, their answer will tell you everything you need to know.